Hello everyone, welcome to another video. So in the last video we treated asthma, which is a known condition affecting the lungs. So today we're going to be treating another common condition that is prevalent in most parts of Africa, very prevalent in Nigeria. So we'll be looking at hypertension. So hypertension basically means high blood pressure, and is a condition where the force of blood against the walls of the blood vessels is consistently too high. So blood pressure is necessary to push blood through the body, but when it stays high for too long, it damages the heart, it damages the brain, it basically damages organs when it's too high. So the brain, the heart, the kidneys, the eyes, and the blood vessels. So this hypertension is often called the silent killer. Why is it called the silent killer? Because many people do not feel any symptoms that their blood pressure is high until serious complications start to occur, and complications start to occur when it's dangerously high, like when it's reaching like 200 over 105. So all those kind of levels can start causing serious complications. So this hypertension, it is one of the most common health problems worldwide. So looking at the anatomy and the physiology, to basically understand hypertension, we have to look at how the normal blood pressure works. So the heart pumps blood through the blood vessels to supply oxygen and nutrients. So the arteries, that's the blood vessels, they need to stay flexible and open to allow smooth blood flow. So blood pressure is the force of the blood pumping against these artery walls during two phases. Number one, when the heart contracts, that's what we call systolic. So systolic is like the higher number when you check your blood pressure on the machine. So systolic is the force of the blood pushing against the artery walls when the heart contracts. Then when the heart relaxes, it is known as diastolic, and it's the lower number. So in hypertension, the pressure remains too high either during contraction, relaxation, or both. So there can be cases where somebody just has their systolic pressure is just high, but their diastolic pressure is normal, or their diastolic pressure is high, their systolic pressure is normal, or both of them are just high. So it has different. So any of them can be high and both of them can be high. So when this blood pressure remains too high, it puts a strain on the heart, and the blood vessels may become narrow, stiff, or even damaged, reducing blood flow to the organs. So hypertension develops when the balance between cardiac output, that is the amount of blood the heart pumps, and resistance in the arteries is disturbed. So factors like narrowed blood vessels, excess fluid in the body, or increased activity of hormones like adrenaline or angiotensin make the heart pump harder. So over time, the heart muscles, they thicken, blood vessels harden, and organs like the kidney and brain, they suffer tremendous damage. So what exactly causes this hypertension? So there are two main types of hypertension. There is primary or essential hypertension, which has no clear cause, and it develops gradually due to, number one, aging, where most of the time you can see hypertension is more common in the older adults. So in this case, we categorize it as primary hypertension. So it's a hypertension that has no clear cause. It could occur gradually due to aging, family history, or unhealthy lifestyle, like your diets, when you are consuming too much salt, smoking, or just stress. So sometimes stress can cause your blood pressure to be high for a period of time, then it will go back to normal. So this is known as primary hypertension. Then secondary hypertension is caused by another condition. So you have another medical condition that is causing your blood pressure to be high. So in this case, for example, kidney disease, kidney disease, thyroid problems, certain medications like steroids, birth control pills, tumors in the adrenal gland. So when there's too much adrenaline being produced, it can cause increase in blood pressure. And then with the kidneys, angiotensin can contribute to this increase in your blood pressure. So there are two types. Primary hypertension has no clear cause, while secondary hypertension is due to an underlying condition that you have that is causing the blood pressure. So for signs and symptoms, so because this condition is known as the silent killer, most people do not have symptoms. But when these symptoms occur, they may include, like, for example, headache, especially in the morning, blood vision, dizziness, shortness of breath, chest pains or palpitations, nosebleeds. Nosebleeds are very rare. But do you know the funny thing? Out of a lot of people that get nosebleeds, I'm actually one of the people that got nosebleeds. There was a time that I actually had my blood pressure was high, and usually when people have high blood pressure, they don't see signs. But me, I actually got nosebleeds, like frequent nosebleeds. But nosebleeds are not very common, they are rare. And I'm actually happy that I was getting this nosebleeds, because if I didn't have this nosebleeds, I wouldn't even know that okay, there's something wrong with me. And I was also having chest pain, palpitations, and nosebleeds. So these were my telltale signs that I had to go and check. I had to go to my cardiologist and check my blood pressure, have an ECG, and all those other things. So nosebleeds are rare, but they can happen. I'm a living proof that it can happen. So if hypertension is left untreated, it can lead to conditions like heart failure, stroke, kidney failure, or even loss of vision. So how exactly is hypertension diagnosed? So diagnosis is based on measuring your blood pressure. Basically, it's just as simple as that, like measuring your blood pressure using something known as a sphygmomanometer. So usually normal blood pressure is less than 120 over, like, systolic 120 and diastolic 80 millimeters of mercury. So that is normal blood pressure, less than that value, sorry. Then when it's elevated, it's between 120 to 129 of the systolic value and less than 80 of the diastolic. Then when somebody is entering stage 1 hypertension, because there are different stages. So when someone is entering stage 1 hypertension, is between 130 to 139 of the systolic, or 80 to 89 of the diastolic. Then stage 2 hypertension, 140 or a higher systolic value, or 90 or a higher diastolic value. Then we come to hypertensive crisis. So this is an emergency, and it requires urgent care, because it has gotten to the most terrible stage. So this is when somebody has a blood pressure of over 180 systolic and or 120 diastolic. So it's usually like all those people that have blood pressures reaching 200 or above. So this is known as an hypertensive emergency. So other diagnosis steps, they may include the doctor might run like a urine test to check for the kidney function, blood test to check for electrolytes, sugar level, cholesterol, then electrocardiogram to check heart function. I mentioned this when I actually went to see my cardiologist back then. They actually sent me to do this electrocardiogram. So it's also another diagnostic step. Then eye examination too, to check if there have been damage to the small vessels of the eye. So other conditions that can present with high blood pressure like symptoms include, number 1, anxiety or panic disorders, because here you'll be having chest pain, palpitations, and all that. Then preeclampsia in pregnancy. So this is when a pregnant woman actually has high blood pressure during pregnancy. So preeclampsia, kidney artery narrowing, Cushing syndrome, thyroid overactivity, and having excess alcohol or stimulant use. So all these can give you the same symptoms that you see if you have symptoms of high blood pressure. So for treatment, number one, we encourage lifestyle changes. It's first line for a lot of patients, many patients, because a lot of things can contribute to someone having hypertension. So, like for example, in case of diet, having a high salt intake increases your blood pressure. So trying to reduce your salt intake, trying to eat more fruits, vegetables, whole grains. If you are obese, losing weight can help. It can go a long way. Then exercising regularly. Exercise is very good for the body, so keeping the heart pumping is very good. And then if you are somebody that smokes, try to quit smoking, reduce alcohol. And stress is like stress is one of the common things that can raise somebody's blood pressure. So try to manage your stress. And then for medications, these medications, they are often lifelong. For medications, we have diuretics. The diuretics like hydrochlorothiazide, they actually help the body get rid of excess salt and water. So if it's excess salt that is causing your blood pressure, they can help in this case. And then angiotensin converting enzyme inhibitors like ramipril, lisinopril, they relax the blood vessels. And then calcium channel blockers like amlodipine, they prevent blood vessels from tightening. Beta blockers like propranolol, bisoprolol, metoprolol, so they slow the heart and reduce the workload on the heart. Then some angiotensin receptor blockers, which can be used as an alternative to angiotensin converting enzyme inhibitors. So these two should not be used together. Angiotensin converting enzyme inhibitors like lisinopril and angiotensin receptor blockers like valsartan, they cannot be used together. If a patient is using a combination of hypertensive medications, they cannot combine these two because they basically do the same thing. They just have it's like, how do I put it, they are like a replacement for each other. So but they basically have almost similar mechanism of action. They work on the kidney. So managing hypertension involves number one, routine blood pressure checks at home or in the clinic or in the pharmacy. Monitoring side effects of medications like dizziness, fatigue, swelling. And it's good for patients to have like a log, like they should be jotting down their blood pressure readings at different times of the day. Try to jot down your blood pressure readings to know if the medications you are taking are actually working. So this is very important in managing this condition. And screen for other conditions, like other related conditions like diabetes, high cholesterol, all these things that could be adding to why the blood pressure is high. So try to screen for all these other conditions. So in summary, hypertension is a chronic condition where the force of blood against the artery walls is too high, often without symptoms, and over time it can cause serious organ damage. So early diagnosis and consistent management are crucial. It's most of the time there are no symptoms, but symptoms can occur, so it depends on the individual. And treatment includes lifestyle changes and medications with close follow-up. And for managing this condition, it's good to try to be consistent when taking your medications. Try to do a daily habit of checking your blood pressure to know if these medications are working, and try to monitor for any side effects that you might be having based on the medication you are taking, so your doctor or pharmacist can like switch you to another medication that could be better for you. So thank you for watching this video. I like to talk about topics that personally I've experienced, so that's why I'm talking a lot in this video. But I'm happy that you watched this video, so I'll see you in the next video. Bye.